Hello, my presentation will be about the nursing care priorities for acute stroke patients. So, my patient was a 68-year-old indigenous male who was admitted with query stroke. His clinical presentations include headache, slurred speech, loss of balance, and lower limb weakness. He was sent to acute stroke unit thereafter. So let me first define stroke. So stroke happens when the brain doesn't get the enough oxygen it needs. There are two types of stroke, the ischemic stroke and hemorrhagic stroke. So the ischemic stroke is when blood flow to the brain is blocked by a clot or plaqued artery. There are two kinds. The thrombotic stroke, it is when the blood clot forms in an artery leading to the brain, or the embolic stroke, it's when the blood clot forms from other parts of the body that breaks loose and travel to the brain. Then hemorrhagic stroke uh, is when a weak blood vessel or artery breaks or bursts and bleeds into the brain. So it is said that stroke or cerebrovascular accident is the third leading cause of death or disability in developed countries. Anyone suspected for stroke should be taken to hospital for assessment and treatment. In order to prevent complications and permanent defects, early diagnosis is the key for stroke patients. However, distinguishing the type of stroke plays a crucial role in patient care. Diagnostic imaging is helpful in distinguishing the type of stroke. This can include CT scan and MRI of the brain. So what are the classic signs and symptoms of stroke? So according to Stroke Foundation, facial droop, numbness, headache, dizziness, loss of balance, weakness in the arms or legs, trouble swallowing, blurry eyes, and nausea and vomiting are some of the classic signs and symptoms of stroke. So for the treatment, in ischemic stroke, thrombolysis is the only medical therapy shown to improve patient outcomes following an acute ischemic stroke. It is more effective when given early after symptom onset. In Queensland, if patient presented within 4 hours since the onset of acute neurological deficit, then they may be a strong candidate for thrombolysis. This will be a one-on-one nursing to patient intervention or ratio. It is because there is a high risk of active internal bleeding and low blood pressure. So for hemorrhagic stroke, there could be an endovascular procedure which can help repair weak spot or break into the blood vessel, or any other surgical treatment that can include a metal clip to be put on to stop the blood loss if the bleeding is caused by a ruptured aneurysm. Let's just revisit my patient's past medical history. So my indigenous patient has a type 2 diabetes, end-stage renal failure, has hypertension, arterial fibrillation, and gout. According to Stroke Foundation of Australia, some of the risk factors of stroke includes AF, high blood pressure, high cholesterol, and type 2 diabetes. So he pretty much have like a few of the risk factors. So for AF, an AF is an irregular pulse or heartbeat. In AF, blood does not move through the heart completely, and because the blood is not properly pumped away, a clot can be formed in the heart. This clot can then break away from the heart wall and travel to the brain where it may cause a stroke. High blood pressure, or also known as a hypertension, is the most known risk factor of stroke. High blood pressure puts strain on blood vessels, including the arteries that can lead to the brain. It damages blood vessel walls and make them weaker, which can speed up common forms of heart disease. It can also cause blood clot or plaques to break off artery walls and block a brain artery. For the high cholesterol, it contributes to the blood vessel disease, which often leads to stroke. It is mainly caused by saturated fats that can build up on artery walls and narrow the arteries, which can block the flow of blood and cause blood clots, leading to ischemic stroke. And type 2 diabetes. So if patient has type 2 diabetes, their body becomes resistant to insulin, and it doesn't not make enough insulin to keep up. So the body has difficulty absorbing sugars from food. Over time, this can lead to increase in fatty deposits or clots on the inside of the blood vessel walls. This can then narrow or block the blood vessels in the brain, cutting off blood supply and cause stroke. So the nursing interventions caring for stroke patients. So for more intensive monitoring is more likely to lead to early identification of patients who are developing complications and who are deteriorating. As part of the stroke protocol, nursing staffs need to do a 4-hourly vital observations, a blood glucose checks, as well as neurological assessment. Blood pressure management is important because there is a transient hypertensive effect within 48 hours following an acute ischemic stroke. Variability in blood pressure is associated with increasing neurological deterioration and an increase in intracranial pressure that can lead to secondary brain injury. Stroke patients are also often hooked up with telemetry or cardiac monitoring for the first 24 to 72 hours post-stroke. It is because cardiac arrhythmias and abnormal ECGs or electrocardiograms are identified in almost 50 to 70% of acute stroke patients. It is then prudent to monitor the ECG abnormalities and trend in QT intervals for any electrolyte imbalance, autonomic fluctuations, and medications, which can then increase the risk of developing sudden cardiac death and/or secondary stroke. Then temperature is also very vital because of its relationship with brain function. Cerebral metabolism, cerebral blood flow, and permeability of the blood-brain barrier change proportionally with brain temperature. So an increase in temperature can increase the cerebral metabolism, which can damage the endothelial cells of the brain and spinal cords, which can then contribute to cerebral edema and increased intracranial pressure. So for airway and respiratory assessment, stroke patients with patent airways but whose oxygen saturation level is less than 94% should be administered supplemental oxygen via nasal prong or Hudson mask. Stroke patients who present intubated or required rapid intubation to secure a patent airway are then at risk of hypoxia as a result of inadequate cerebral tissue oxygenation. This will then advance to their neurologic compromise related to the disruption of the autonomic nervous system. Injury, infarction, or ischemia on the midbrain, pons, and medulla are in jeopardy of compromising the airway for these areas, regulate cardiac and respiratory function, and then, because of that, these are pivotal in maintaining consciousness. So for the blood glucose monitoring, 4-hourly BGL check is also important. It is known that all diabetic patients and approximately 50 to 60% of non-diabetic stroke patients will present with hyperglycemia in an acute phase, especially in severe strokes that involves damage in insular cortex. Hyperglycemia is a sympathomimetic stress response which can exacerbate neurologic injury via multiple of mechanisms related to increased cellular acidosis and post-inflammatory responses. It can also weaken and damage blood vessels and contribute to plaque formation, like what I discussed earlier. And neurological assessment is also very important because it determines patient's neurologic function that includes its cognition, behavior, visual, motor, and sensory function after stroke. Stroke patients are in need of high acuity care in order to monitor their neurological functions, assess their deficits, and recognize early deterioration to improve patient outcomes in general. It is very necessary that these stroke patients should at least have like 1 nurse to 4 patient ratio so that they can be looked after appropriately. Thank you very much for listening.